This is Eric Guzik, Chief Technical Officer at Patientone. I'd like to provide a brief demonstration of our clinic-facing application, show you some of the key new features that we're now providing to clinics as they better engage with patients both before and after their surgical procedure. And I'd also like to show you some of the key remote patient monitoring tools that we've created to better track that time and allow clinics to be reimbursed for the time that they're already spending keeping patients safer and on track for their procedure. Currently, when patients are scheduled for a surgical procedure, they're usually either given a paper handout, and that paper handout is a copy of a copy of a copy of a copy, or they're given verbal instructions directly by a nurse or scheduler, or perhaps the doctor, him or herself. And those instructions are very easy to forget. Obviously, this is a very stressful time for the patient. Studies show that less than 20% of information shared with a patient verbally is remembered by that patient. So in place of those paper handouts and verbal instructions, what we've created is a digital notification platform. And our goal is to provide patients with the right information at the right time. This is a platform that has been built from the ground up with the help of clinicians, doctors, surgeons, nurses, schedulers. So we've tried to really create a very usable platform that provides clinics with the tools they need to help keep patients on track. If you think back to the first video, that was a video demonstrating the patient-facing application. The patient receives notifications on a set timeline, and those notifications have been designed to keep that patient on track for their surgery. As an example, a notification might be sent to the patient 6 days before the procedure, reminding them to stop their blood thinning medication. Another notification might be sent a day before the procedure, reminding that patient not to eat past midnight in preparation for their procedure. So these are notifications that might be information-based and might include a video, but they usually entail some key actions that that patient needs to take in order to stay on track for their procedure, both preoperatively and postoperatively, for a safe and effective recovery. So now what we're seeing is the clinic side of this interaction between clinic and patient. So when the clinician logs into the Patientone account, the clinic-facing application, they are presented with a dashboard that provides key information about how well patients are doing staying on track with their notifications. And what we've done here, you can see there's some key information boxes. We have a red box here, which is an intervention needed case, and this shows the status of those patients who have generated an alert. And I'll explain in a moment how those alerts can be generated. We also have here a box for any unread patient messages, so a simple message inbox, and then any assigned tasks that have been given to this care team member. And I'll also get into some of the team functionality that we've created for clinics, and that is kind of the model we're following as we allow clinics to monitor patients. You can certainly monitor a patient individually as a care team member, but we do allow clinics to define teams and task teams with monitoring certain protocols, certain procedures, and certain patients. So what I'd like to do is just begin with an overview of these three main boxes. And again, this is an intervention needed status box. We have some unread messages here from the patient, and then assigned tasks. So I'm going to click on this first box, and this is the intervention needed status box. And we can see here that we have a patient, Jack Jackson, who has generated an intervention needed alert. And what we're showing here is Jack's information. We have his phone number, we have his scheduled procedure, the scheduled date of that procedure, the surgery center, the physician, and then we can see here just a quick way to determine where Jack is relative to his procedure date. We're 2 days before his procedure date. So the other information we see here on this patient card is the alert that's been generated. And we can see in Jack's case this alert's been generated for what to expect, that notification that is sent that explains what to expect for this procedure. So at this point, what I can do is view Jack's care plan to discover more information about where Jack has fallen off track. We can resolve this issue if this is an issue that we think is capable of being resolved at this point. We can assign this task to a different care team member if we'd like to. And again, I'll explain that notion of teams in a little bit more detail in a moment here. But let me begin by just showing how we can assign this task to a care team member. So if this is an item that we believe, as a certain clinician or provider, that it may be better handled by somebody else on the team, we can assign that to any member of the teams that have been defined as part of this office. And again, I'll show you this functionality in a moment where we can define teams at the office level. So for example, team 3 might be a triage team. It might be a team of nurses. So we might assign this to Debbie Duncan, and then just add a quick note here explaining why Debbie has been assigned this task and what we know currently about this alert. So what I'm going to do instead, I'm not going to assign that task to Debbie. I'm going to view the care plan for Jack and try to figure out what's going on here with Jack. So here is a more detailed, robust explanation of Jack's care plan. And now I get a good sense of how Jack's doing with his care plan. And you can see here the notifications that have been sent to Jack as part of his preparation for his procedure and how well he's doing staying on track for his procedure. And you can see we've sent notifications for facility pre-registration, for video education, for NSAIDs and supplements. And for all of these notifications and tasks so far, Jack has responded that he's pre-registered, he's watched the video, he's stopped his NSAIDs, so he's been doing well keeping on track in preparation for his procedure. You can see because of that, because Jack has responded in a way that indicates that he understands the information and he's also performed the action that we've asked him to perform, we've marked that as no action needed. And I'm going to show you the logic behind how we define notifications in a moment. But this, again, gives us a way to understand where Jack is doing well and where he's falling a little bit off track here. Okay, so let's take a look at what to expect. And you can see here the response that's been generated is, I have a question, please call me. And if we need to view the entire notification, we can do that. So here's a notification that Jack has a question about. And this is the exact notification that Jack receives. This is the exact look and feel as well of this notification. And you can see here's that key information that Jack's been given about what to expect for his procedure. And you can see Jack responded, I have a question, please call me. Now this is a response that we pre-populated in the notification. If you remember back to the first demonstration, video number 1, this is one of the options, one of the answers that we provide to Jack to allow him to quickly update us on his status. So let me close this box. And we can see intervention needed. I have a question. Please call me. So at this point, the clinic could call Jack. His number is here. Or what we can do as an office, as a clinic that needs to respond to this case of what to expect, we can message Jack. So we have a patient messaging window here. And just as Jack can message the clinic within his patient-facing app, the clinic can also message Jack using the application that we're now demonstrating. So I'll just enter a quick message here. So, hi Jack, what is your question? Okay, and that message will then appear within Jack's account. When Jack reads it, it's going to show message read by patient here. So we'll get a good indication whether or not Jack has received this message, if he's read this message, and then any response that Jack provides will show up in this patient messaging window. So two of the key features we provide to clinics, we allow them to create these auto notifications that are sent to patients. And again, I'll show you our protocol engine in a moment and how we define these notifications. The other form of communication that we support is this bidirectional communication with the patient using this type of messaging interface. So those are the two basic forms of communication, the automated messaging, automated notifications, and then that bi-directional type of messaging where the patient can free-form text and ask any questions or provide comments, feedback, anything like that, and vice versa. The clinic can message the patient using this type of interface. So on this care plan page, and you can see we've moved from dashboard to care plans, and again, care plan would be that more detailed, robust description of both the tasks, the notifications that the patient must follow, and then also how that patient is doing as they receive those notifications. And if we need to edit any of this patient information, we can do that using this patient information tab. And just one more quick feature I want to show you in this care plan page. We can also show a complete record of any interaction between Jack and the clinic. This is more of a visual representation of the communication. And you can see again these two basic forms of communication: the automated messaging with a patient response. These are already pre-created, pre-populated within each notification. If the patient does send a message, you can see it would be reported here. The clinic, in this case I am playing the role of clinician, my comment or post is shown here on the timeline. Okay, so those are some of the main components of the care plan page. And if I wanted to resolve all issues, I do have a way to do that. You can see we're also breaking up notifications by pre-op and post-op status. I'm going to go back to the dashboard. And again, that was an example of the intervention needed case. If a patient sends a message, now this isn't an alert created by a response by the patient to a notification. This is more of that messaging within that messenger window. Those messages appear here, and this is more of an inbox, as I mentioned earlier. So you can see here we have two unread patient messages, one from Bruce, the other from Carrie. And again, we're showing that key patient information, showing their status relative to the procedure date. Bruce is about a month before his scheduled procedure date. Carrie is actually post-op, so she's 11 days post-op. And you can see not only we're listing that information, but we're also listing the message itself, of course. We can respond back to that patient quickly here using these buttons. We can show a message history if we'd like. And we can also assign this message to a different care team member if we would like to do that. Okay, so that's the dashboard. Originally, the dashboard was designed to be more informational. I think what we've discovered working with some of our key partners during development, schedulers, nurses, physicians, they requested that this dashboard be more action-oriented. They did not want to click through cards in order to get the messaging. So now we do include messaging buttons as part of some of the functionality within this dashboard. So we're going to keep working on that functionality, keep improving that functionality, and keep improving how usable this dashboard is. But the idea now is the dashboard really serves two purposes. It does provide a summary of key information about patient monitoring, and it also provides a way for that clinician to respond quickly to that patient, given the information that they've been presented. So let me go ahead. I've shown you the dashboard. I've shown you care plans. I also now want to show you patients and how we create a new patient account. So here's our basic patient page, and you can see it's just a table of current patients within the system. We are going to be improving this UI using that card system that you saw on the dashboard. We'll be implementing that same type of UI on this patients page. So let me go ahead and quickly create an account here. And you can see we can determine how to actually communicate with the patient. We can communicate via mobile push notification, email, SMS notification, or traditional text notification. So you can see we do offer a multimodal method of communicating with patients, either via mobile app, that would be the push notification, traditional email, or text notification, that would be the SMS notification that we have listed here. I can enter the patient's phone number, and and that will allow us then to communicate with that patient via text message. And we're now on tab 2 of this patient registration page, and this tab is named Patient Conditions. Here's where we can check patient-specific conditions. What this allows us to do is to map notifications by condition. So for example, if we have a patient who requires diabetic clearance, I can mark this box, and that will pull in a notification that will only be sent to those patients who have been so marked. Same for prescription blood thinners. So one unique advantage that we provide as a company, we allow clinics to create any number of different patient conditions that they think are relevant to their practice, and also create notifications that are mapped to those conditions. So this is a set of prescription blood thinners that we've created for a particular practice here in Missoula, and you can see we've been able to drill down to a particular type of blood thinner, whether or not the patient requires a bridge or not. And you can see, because of that, we can now distribute and disseminate information that is very patient-specific in a way that our competitors are currently not able to match. So I'm going to click Next, and we're now on tab 3, Procedure Information. So we can select the type of procedure. I'll select ESWAL. And we then show the different types of that procedure that we have in our current library. And I'll show you our library set in a moment and how we define a library for a specialty. But for the office, they have these variations available as types of ESWAL for their patients. So I'm going to select with stent out of town. And what the program's doing now, it's pulling in the notifications that we've defined for this procedure, and we can now edit those patient notifications. So here they are, and I'm going to show you this protocol engine at the patient level, but I also want to show you the same engine at the office level. Currently what we're seeing here is a notification set that has been created for this procedure. Here is facility pre-registration, video education, EdSeds, and supplements. What we saw earlier were some responses by patients to notifications like these. At this point, what I can do as a clinic is get right in there and change any of these notifications at the patient level. That is a very unique differentiator for patient one. Competitors like Health Loop and Twistle do not allow clinics to change and to really drill down at the patient level for these notifications. If the office does not want to edit notifications at the patient level, they're not required to do so. In fact, they're given a default notification list, and you can see we hide that list by default. And only if the office requires editing of these notifications at the patient level do they need to get into this editing capability. So I'll go ahead and leave that closed for now. I'm next going to assign physician, and then facility. Facility would be the actual surgery center or location of that surgical procedure. What this allows us to do is also share information about directions, maybe a phone number for that surgery center. If it's an external type of surgery center, if this is a procedure not done on site, we can serve some nice information to the patient, again, to keep them on track for their procedure. Go ahead and click Next. And finally, we can define some key dates. These dates are also definable per specialty and per office. Again, this is very unique to patient one. We're giving offices flexibility and some ways to modify their care plans in a way that our competitors currently we don't believe can match. So I can enter procedure date here. So this date may be 2.5 weeks in the future. I can then set the time. Okay, you can see check-in time has been automatically populated. This is a rule we can set at the office level, and I'll show you that functionality in a moment here. You can see we've also defined discharge date as a key date as part of the care plan. So I can enter that now. If I don't know the discharge date yet, as a clinician, I can always add this later. So I'm going to leave that empty for now. The other nice thing, again, that we provide offices, there's no limit to the number of dates, different types of dates that they can enter as part of their healthcare plan. Again, the office can define these as part of their office setup. For some of our clinics, they sometimes have 10 to 12 different dates that they now include as part of their care plan period. Everything from preoperative testing to post-operative follow-up to cardiac clearance dates. So again, there's no limit to the number and types of dates that can be defined by an office to keep patients on track. And again, that is one unique feature of the software solution we've created at Patientone. So I'll go ahead and create that patient account, and that then sends the patient a registration message and email. And that is something that we reviewed during our first demo of the patient-facing application. And what I'd like to then show you is more of a deep dive into our protocol engine. So we did get a taste of some of the some of the control we have over notifications at the patient level. What I'd like to show you then is a little bit more detail about our protocol engine. So I'm going to go ahead and jump right into protocols, and you can see that's under this More tab on the menu. So this is a tool that is available to offices as they fire up the Patientone Connect platform. And what I'd like to show you here is a library that we offer to our clinics. And you can see this is a protocol set that's available at the office level. And you can see we also show patient level protocols. An example of that would be the account I just created, where we applied an office level protocol to a patient, creating a unique patient protocol. In any event, what I'd like to do is just describe briefly where these protocols come from and some of the flexibility that clinics have using our protocol engine. So we define a library set of protocols at what we call the master level of Patientone. And that means we provide content that's pre-created, it's pre-populated in clinic accounts, and we make that library available to clinics. So we are able to get offices up and rolling quickly because we create the library that they can then access in order to provide their patients with the notifications they need to be on track, and so on and so forth. So what we see here then is that set of protocols that we've provided to this urology office. And you can see we can offer templates and then the actual protocol set that the office can use in order to better keep their patients on track. So let me go ahead and edit one of these protocols. And when I edit, you can see here it brings up the name of the protocol, the category, and this gives us a way to create different versions of a protocol if we'd like to. And again, that allows us to customize protocols according to the needs of a particular clinic. If I go ahead and then edit patient notifications, there's where we see that notification list. And you can see here there are 13 notifications that are part of this master protocol list. And everything from a reminder about facility pre-registration, a video education notification, a reminder about when to stop NSAIDs. And then you can see, if we scroll down, there are condition-specific notifications. And this would be an example of those notifications that are only sent to those patients who have this condition marked during patient registration. So we can now send a diabetic clearance notification only to those patients who we have marked with that condition during patient registration. And this is just a subset of some of the notifications that are condition specific. But again, this allows us to define a very robust set of notifications that can cover almost any patient scenario, any set of conditions. So again, a level of flexibility that's very difficult to match currently in the marketplace. So let me scroll up, and I'm going to begin here actually. I'm going to look at video education. I'm going to open and edit this notification and just explain how we define a notification in a way that allows it to be sent to the patient with a certain amount of information at a certain time. So you can see here the type we've defined as pre-op, and we have two options, either pre-op or post-op, and this allows us just to categorize notifications for display purposes later. So we've marked this as pre-op. We've provided a task name, video education, And you can see here, the next field is task description. And this, of course, is the meat of the notification. And we're providing a very simple WYSIWYG editor. We can embed a video, as you see here. We might embed an image, embed a file. We can create links, of course. So, any standard action, any standard formatting that you can perform with a content management system, those are some of the tools that we've included in our protocol engine. You can see here we also have some tags that can be included, including patient name, physician name. I mentioned earlier how we can define facility. So that might be an external surgery center. So if we do have an ambulatory surgery center, we can include the location, phone number of that ASC. So again, it provides us a way to provide some of that key information to patients as they prepare for their procedure. If we scroll down here, we set when this reminder will be sent. So you can see here, this reminder, this notification will be sent 12 days before the procedure date. So any of this information we can edit. Could be hours, could be days, could be before, could be after. And what's really cool here is we can set this relative to any date defined by this office as part of their care plan period. And you can see here in this account we have 4 key dates that have been defined as part of that care plan period. There may be up to 10 or 12, as I mentioned earlier. So the flexibility that we have with this system is unmatched. If I scroll down, we can also set a deadline. And that deadline is when we expect that patient to respond to the office to provide that key information. The deadline may not be that important for a video. Watching a video may be critically important for letting that office know whether or not a patient has stopped their blood thinning medication. And that, again, is one way that we can trigger an intervention needed warning. That alert will be triggered if the patient does not respond by this set deadline date. And if we do not set the deadline, then there's no warning generated. So we may not set a deadline for watching a video. For a blood thinning notification, we probably would want to set that deadline just to make sure that patient's on track. We can set priority level, and this is just a way to filter warnings later on the dashboard. And then again, we can mark here whether or not this notification is mapped to a patient condition. And I'll show you an example of that in a moment. So some of the other functionality, we can manage the answers that are part of the notification. And you can see here, these are answers that we define when we create this notification itself and define the protocol. So here are the 3 answers. I've watched the video, do not have any questions. I have not watched, I have watched and have questions. And you can see here we've defined an action for each of these answers. No action needed, actively monitor, intervention needed. So if the patient watches the video and responds that I've watched the video and I have questions, that does throw up the flag for intervention needed, and that's how we generate that warning on the dashboard. If we set a deadline and the patient does not respond by that set deadline, that would be the other way that an intervention needed flag is thrown in our system. Of course, we can edit, we can delete. I won't show you that. So if I then scroll down here a little bit more, and I do want to show you that condition-specific notification. So if I click edit, that then brings up this notification, pre-op, prescription blood thinner, and you can see here we are using some tags, and here are a listing of the tags or placeholders that are available for this office. And you can see here this is a reminder that's sent out 6 days before the procedure date. Here are the responses that are pre-programmed as part of that notification. The patient just has to click one of these to let us know how they're doing. And then we have a deadline. Now that may be 4 days before, could be hours. So however the office wants to define that deadline or whether or not they have a deadline, they have that opportunity to do so here. We can set priority level. We might want to set that as highest. And again, here's where we mark whether or not this condition is mapped to or whether this notification is mapped to a condition. You can see in this case it is. It is mapped to only those patients who have been marked as being on Coumadin and warfarin during patient registration. Okay, so this message will only be sent, this notification will only be sent to those patients. Okay, I'm going to go ahead and close that. You can see we have post-op notifications, post-op check-in, and again, there's no limit to the number of notifications and types of notifications that we can provide to clinics. So let me go ahead and I'm going to cancel out of here, and I want to go back to this master protocol set. The other thing that's unique about Patient One is that we put this tool, this protocol engine, in the hands of the clinic. So if a clinic would like to create a variation of as well no stent, they can do so. If they'd like to edit, of course, they can do so. They can also delete. So they have quite a bit of control over the types of protocols that they can offer to their patients. So let's say they're working on a new type of vasectomy protocol, lithotripsy. They have complete control over the tool set that they need in order to create that new protocol set. They can create a new protocol entirely, and you can see here it gives them the ability to define a name, the type, procedure category, and then get right in there and begin to create any number of different types of notifications. Okay, so let's say we do have a clinic. They have as well with stent in town as one of their protocols, and they want to create a variation. They would click clone. That creates a clone, and you can see here is that clone protocol. They could then begin to edit that protocol, give it a different name, and begin to define the types of notifications that are part of that protocol. So anyway, a quick way for offices to get up and running. We provide them with a pre-created library of content. And again, offices have a tool here, this protocol engine, that puts complete control over protocol development, management, editing in the hands of the clinic itself. Okay, I'd like to move next to maybe the main value proposition of this platform, and that's remote patient monitoring. In addition to keeping patients safe, keeping patients on track, reducing cancellations, reducing complications, what our platform provides is a way to track the amount of time that a clinic is spending monitoring patient progress. And we're automatically collecting this time in the background as a clinic reviews patient information, messages a patient. We tabulate all of those times in increments, and we provide a report to the clinic for remote patient monitoring reimbursement. So let me go ahead and bring that page up, and you can see that's the next item in the menu, patient monitoring data. What I'd like to show you here is how we're tracking this time for reimbursement purposes. We've spent quite a bit of time on how we're reporting this information to practices, and you can see here our first tab, we're showing patients who are not eligible for reimbursement. So this is reimbursement for the 99457 CPT code, and that does require a minimum amount of time of 20 minutes per calendar month for reimbursement. So here is a listing of patients who have not met that time, and we can sort here by time. And you can see that, some of these patients are close. In one of my testing accounts, I reached 19 minutes, 50 seconds, but that doesn't really meet the threshold, 20 minutes, so we cannot place that in the eligible for reimbursement tab. Here we have Bruce, 16 minutes, and some other patients here. These are patients who, we've monitored for a certain amount of time, but again, we haven't met that threshold. If we click here then on eligible for reimbursement, here are those accounts where these patients have met that threshold, and we can now, as a clinic, be reimbursed for the time we've spent monitoring these patients within this platform. So this Patient One platform is a remote patient monitoring tool. Not only, again, are we providing a tool to send notifications, the right information at the right time for patients to keep them safer and on track for their procedure, but now we're collecting that time, or we're making explicit that time that clinics are spending keeping their patients engaged and keeping them on track. And in many ways, what we're doing is making very visible this time that clinics are already spending with patients, and we're calculating and collecting this time in a way that allows for a paper trail, auditing, giving that data to clinics that they need for insurance reimbursement. So you can see here we also have tabs for submitted for reimbursement, whether or not it's been paid. But the main feature that we have and the main value proposition we feel with a platform like this, again, is allowing clinics to be paid for the time they are spending keeping their patients on track for a successful procedure and a successful recovery. And that's a very unique value proposition that we believe we're bringing to this patient engagement market. So I want to show you one final feature, and that is the actual office setup itself. And I'm going to go ahead and bring up office setup. And again, I think this gets to the level of customization that we provide to clinics. You can see here, here's just basic information about the clinic, name, they can upload their own logo, they can detail the contents of the email sent to their patients, the SMS message sent to patients. You can see the email to family members can also be tailored to the needs of the office. So quite a bit of customization is possible for the office. And I want to show you some of the newest features we've added. If a patient messages an office while the office is closed, we have here a pre-populated message that will then become an auto response. Some of the other information, time zone, of course, but, the working days during the week, so we can determine, when to send this auto notification if the office is closed. We can set the time to send daily notifications. Here are some new features we recently added. You saw earlier how check-in time was set as an offset based on procedure date, where here is where we can set those rules. And again, the idea is to make this data entry as easy and as usable as possible for the care team staff. So any of these dates we can edit, we can add rules in order to create those time offsets. Here are some of the other types of parameters that we can edit and define per office. So the different dates I mentioned, we can add another date if we'd like to. There's no limit to the different dates that can be set relative to a care plan period. We can even define conditions, condition categories. All of these are definable, and we, again, put this tool in the hands of the clinic. That's unique to Patient One. Other companies like HealthLoop and Twistle, they need you to contact them to help set this up, and they don't offer this type of tailoring and customization for conditions. You get one blood thinner condition, that's it. If you want different types of conditions for blood thinners, that's just not possible with our competitors' products. So, we offer quite a bit of customization, a way to really detail in a very patient-specific way, how we distribute this information as part of our notification protocol to patients. And again, I think when we look at the value proposition of what we've created here with this Patient One Connect platform, we allow offices to serve pre-created automated notifications to patients. They can track the progress of their patients using this new dashboard that we've created. Patients can message their clinic if needed, and that's shown here. In addition to all of those efficiency features, those communication features, those safety features, really the game changer for us is that remote patient monitoring time. The fact that we can automatically track this time within this back-end system, provide a report to clinics, and allow them to be reimbursed for the time that they're already spending with patients and the time that they can now spend with patients using Patient One. This is a tool that not only pays for itself, but has a possibility of being a revenue generator for those offices that begin to use this form of remote patient monitoring.